Most Singaporeans prefer to die at home, but only 3 in 10 of them know what palliative care is all about. A survey conducted by local non-profit Lien Foundation on over 1,000 adult Singaporeans highlighted common misconceptions and barriers towards palliative care. 65% of those surveyed prefer their home to be the place of care if they're dying. Yet there are many who are still unsure of what palliative care entails. Now, for example, many wrongly believe it is restricted only to the last 6 months of life and they need to give up curative treatment. For Singaporeans who are unlikely to seek palliative care, they cite reasons such as being focused on curing the illness, high costs of care, and a perceived lack of need. Now, when faced with death, Singaporeans' concerns include being a burden to loved ones, medical costs, and the suffering leading up to death. The Lien Foundation has since partnered Tan Tock Seng Hospital to train active aging and hospice daycare centres on handling patients outside hospital settings. They are targeting 800 patient enrollments across 8-day rehab centres by end 2028. Now, with this, doctors hope to dispel the stigma of palliative care, especially with the number of referrals rising. Now, for more on this, we're now joined by Associate Professor Alethea Yee, Director of Education at the Lien Centre for Palliative Care at Duke NUS. She's also Senior Consultant at the National Cancer Centre Singapore. And we also have Dr Neo Han Yee, Head of Department and Senior Consultant of Palliative Medicine at Tan Tock Seng Hospital. Prof Yee, Dr Neo, warm welcome to the both of you. Prof Yee, first of all, what is Singapore's current palliative care capabilities on a national level? How has it grown or changed over the years?
Well, currently we have about 82 specialist palliative care doctors, and we expect to train about 60 more in the next 4 to 5 years. But this is clearly not enough because we have a population of 5.8 million, and we know that's going to project it to increase to about 6.5 million in 2030. And with an aging population, we're definitely going to have more people living with chronic serious illness. And so we are not having enough healthcare professionals to meet this need. And I have to add and stress very strongly that we cannot just rely on doctors alone, that the nurses and allied health are actually equally important. So I would think that this is our current landscape at this point in time.
So we have improved a little bit, but it's really just not enough at this point. Dr. Neo, we were looking at the survey earlier. It's highlighting that, stigma remains around the term palliative care, associating it primarily with death and dying. What needs to be done to change this perception and the understanding of it?
Right. When we go on the internet to look at palliative care and search palliative care, the icon that comes up is that comforting hand that holds the immobile patient on a deathbed, So if, let's say, the Google search is going to churn just these images, everyone would think that palliative care is for the imminently dying. But realistically, palliative care can be so much more. So in this partnership with Lien Foundation, we basically empowered our day rehab center providers to deliver what we call palliative rehabilitation for patients with heart and lung failure. And these patients have a life expectancy of years. And what we want to do is to relieve their symptoms, build up their muscle reserves, endurance, so that they can live meaningful lives functionally in the community. And that's something that we need to showcase to the public, that palliative care is not just the caring hand. It is the caring hand, but it's also much more than that.
And part of this misconception is that palliative care comes in only at the late stage of serious illness. In fact, more than 90% of those surveyed responded this way. How do we convince patients and their caregivers to start the treatment or the care earlier and really make use of the resources available?
Yes. So I think humans are creatures of needs. When they reach a crisis state, they need to be told that where the resources are to solve their problem. So we have to create services that match our patients' needs and create the narratives, the success stories of our patients, and tell these stories to the public so that these narratives stay with them and they know, that they can be one of these patients who receive this care really upstream and then recommend other family members to receive similar services.
Okay, and Prof Yee, we were talking about the need for all healthcare professionals to be trained in the basics of palliative care. You said, it's quite unfair to do that. It's a lot of work. So how would Singapore need to go about doing that to ensure, adequate training and manpower?
Yeah, patients encounter many healthcare professionals in their illness journey. They cross many settings, and with increasing chronic serious illness, there's always this element of suffering, and the palliative care approach really is about recognizing the suffering, addressing it in a very person-centered way. And evidence have showed that when we integrate the palliative care approach alongside life-prolonging treatments, it actually improves quality of life, decreases anxiety and depression, and improves caregiver stress. And so, because of that, and because we don't have enough specialists trained in it, really, if you think about it, what we really need to do is to make palliative care the core business of every healthcare professional. In other words, they are trained in at least the basics of palliative care, and they can integrate it into their standard of care. And that's how we can actually reach as many patients as possible. And so for that, the Lien Centre for Palliative Care at Duke NUS has been running many such courses to train healthcare professionals in basic palliative care. And we customize it to their disciplines, like customized to the renal, the cardio, ICU and primary care setting. And I would say there are many institutions have come aboard, like NUS, the Polytechnics, and PALC and NTU as well.
So it's really like a whole village approach to this, instead of relying on palliative care specialists. But is it easier said than done, though, Dr. Neo? How realistic is it on the ground when healthcare professionals already juggle a lot of patients and tasks? Yeah,
I would say that it is a moral imperative that we get it done, right? Because by 2030, 1 in 4 of us would be a senior above the age of 65. The burden of symptoms, the burden of functional decline will really be something very palpable to us, and we have to fix these services to meet this need. Actually, on the ground, in the hospital setting, there are many specialists who have already, in Hokkien say, kichu, they know that their patients are suffering, they need specialized services, and they are already initiating these collaborations with palliative care professionals to create services really upstream for these patients to enjoy palliative symptom relief, psychosocial support, as well as rehabilitation. So I think this is something that we have to look at from societal angle, and resources need to go in to help not only the palliative care professionals, but also other generalists, other organ-specific specialists, community providers, to be comfortable with delivering basic palliative care.
Our times are changing, our population is getting older, Prof. Yee. The government has previously announced the increase in palliative care specialists or capacities. How will it need to adapt to the changing needs of our society?
Yeah, I mean, MOH has really in the last few years, ramped up the resources for palliative care services and improve access. But I hope that society as a whole will actually see that relieving suffering in chronic serious illness is not just the role of healthcare. It's actually also the role of society. And really we need a whole of society approach with the involvement of social agencies, civil institutions, religious bodies and volunteers to really build this very person-centered approach to suffering. And then can we call ourselves a compassionate society?
All right, that's a very important question to ask ourselves. Prof. Yee, Dr. Neo, thank you very much for coming in to speak with us. That was Associate Professor Alethea Yee from the Lien Centre for Palliative Care and National Cancer Centre, Singapore, as well as Dr. Neo Han Yee from Tan Tock Seng Hospital.